I've been doing enrolled nursing for the last probably 15 years, so I'm very comfortable with what I do, and I think I do a very good job. I've got support of my peers, so for me I get satisfaction knowing that I can make a difference. So Claire's been here for 4 weeks and she better go back to Western Australia, and she's just one of the agency nurses that we have here. So she's a registered nurse, and we're going to check out some DDs, give some morphine to this patient who's in a bit of pain, and I'll check it off with Claire, and then Claire will give it. And this is us all.
Yep.
Yeah. I feel I'm a bit more part of the team up here. I have my own 4 or 5 or maybe 6, 7 patients, and even when I do night shift, which we do every 4 weeks, I'll get 9 or 10 patients to look after. So I feel like I'm actually part of the team and making a difference, and I can kind of ring up doctors and stuff and get their opinion about things, rather than always at the beck and call of an RN. So I feel like I've got a bit more scope of practice to use my knowledge, what I know, grabbing that, and I'll draw these other ones up, and then you come back. So I got Joe, the other RN, to give my antibiotics for the 10 o'clock round, and I'll just draw up some other stuff now for antibiotics for this other person, and just to get it checked off, and then she'll give that as well.
Have you always given out medications as an EN, or is it something that you did?
In Northern Territory, I did a course up here, a medication endorsed course, and which allows me to give drugs on a basic ward round. You have to modules you have to complete and get supervised, and then get signed off. So I've been here for about 1.5 years now, and it's mostly on this ward, and it's been a really good experience for me up here. They're very, very supportive in the education up here, and there's a few other things I've done for enrolled nursing, which is a little bit different from other states, where you can do venipuncture, which is blood taking, which is also another package of what we can do, and so it gives me a bit more scope of practice to what some other states, maybe like Victoria, where I used to work before.
Hi, I'm Vanessa, and I'm a Division 2 nurse at Monash Medical Centre in Clayton. I like the fact that you're working together to help a patient get better eventually and hopefully go home.
Listen to his chest.
A typical day is basically starting, getting on the shift, organising your patients for the rest of the day, organising when things are due and tests for the patients, working with your team member, seeing what they're up to.
In the acute setting, they're able to recognise illness, they're able to understand the pathway of illness and how to treat that illness. And if you have that skill, there's no reason why you shouldn't be allowed to practice in that area.
My name's Vanessa, I'm one of the nurses on this afternoon.
Division 2 nurses are a critical part of the team that works on the ward. They provide quality patient care, participate in all levels. We have a 4-bed high dependency unit, which my Division 2 nurses work in as well. We have educators that help upskill them to the level they might need to be on certain shifts. They train within their scope of practice, and we love to support them in all ways to facilitate their ability to practice as good as they can.
Oh, it's been great. Like, you're exposed to so many different areas of nursing, and it's really good. I love nursing.
Oh, good.
Yeah.
I'm just going to listen to your chest.
Having a large supply, if you like, of Division 2 nurses is good for Monash, good for nursing, and good for the future of career of looking after patients. And that's why we're promoted, and that's why we're looking for Division 2 nurses to come and work in our premises.
Now this injection is called painless because it goes into the subcutaneous layer of your tummy. So it's just
Well, the advanced skills are that they allow us to do medication, so we have to do a medication course, and it's a self-learning package that we do, and then you have a study day, and in that study day there's a calculation exam that you have to sit, and you have to get 100% for that calculation exam before they pass you. Once you've acquired the medication competency, then you're then led on to other competencies, like I've just done the opioid infusion competency. And it also allows us to check off the medications, and then the RN just check the patient with us and then leave us with the patient to give medications, and that's DDs that I'm talking about there. But with oral medications, I have my own keys and I do my own oral medications for the patients now. The medication side of everything has been the big advancement in this advanced skills. The other thing that the advanced skills allows us to do now is I can be a preceptor. So a student nurse coming on the ward, or an enrolled nurse that's just graduated coming on the ward, I can be their preceptor now and I can help them with their appraisals. I can help appraise them, and I can teach the staff coming on the wards now as well. So that's a benefit as well. I can also participate in ward auditing and more administration things along with the RNs now.
Mr. Smith,
Yes.
would you like to come through?
I get a lot of satisfaction out of patients coming into hospital who need help. They come in sick. You're part of the team to help get them better. You're part of the team to help supervise them and to support them. And then to see the patient being discharged from hospital in a more healthier frame of mind and body. I get a lot of satisfaction out of that. I get a lot of satisfaction too out of working with staff members that are able to help me further my education and help me to learn as well. And I enjoy looking after people and just being there to support them.
Royal Perth Hospital at this current time has 12 to 14% enrolled nurses against registered nurses. I actually think there's some private hospitals in Western Australia and eastern states go up to 30% whole of hospital. We could tolerate about a 20 to 22% increase, which means that if we did that, we would have to have a state strategy to get more enrolled nurses into the TAFE program, have a better articulation between the enrolled nurse program and the registered nurse program, and we would then create more numbers of registered nurses for the rest of the hospitals. And another hospital down the road in Western Australia has a tertiary hospital, not quite as complex as this one in terms of some of our specialty services, only has an 8% enrolled nurse. And they do that because that's what the nursing leadership at that hospital want. I don't think that should be their choice. If they move to more enrolled nurses, that would free up more registered nurses for the rest of us. So I think that's what we should do as a state, and we would do that first. And I think the eastern states should do that as well, which means you would have a very extensive enrolled nurse program.
We're now moving towards skilling our enrolled nurses to more advanced practice issues. So traditionally things that may have been done by the registered nurse are now being done by enrolled nurses with the appropriate education and training that goes along with that. So things like being able to administer medications competently and safely meeting legislative requirements such as the Poisons Act is a big move that we've certainly undertaken here at Royal Perth Hospital. Also developing other skills such as the management of opioid infusions, patient control analgesia infusions, managing different aspects of care such as complex wound management, and depending on the area that you're working, specialising some skills for those nurses as advanced skills in that area.
I think there's much better understanding in the health workforce community of the potential for Division 2s to make a great contribution as part of the health workforce, and I think it's exciting for nursing. I think that Division 1s in a number of settings will need to look at how they work with Division 2 nurses, and I'm hoping that Division 2 nurses will be much more valued as part of the health team.
But more so now, I think there's perhaps in the employment sector there's been a lack of understanding about the contribution enrolled nurses can make, and clearly we are now working on that to ensure that they do understand that enrolled nurses are a nurse and are legislated and registered to contribute to the health system.
Eventually, I think the scope for enrolled nurses so that they can actually evolve into a fuller range of responsibilities and have the opportunities to develop themselves through education and training, that is postgraduate courses or certificates that they may be able to attain that entitle them to credits towards university-based bachelor degrees in nursing, and that will ultimately be the scope for the enrolled nurse should they choose to pursue that line.